How do you choose a high chair for your baby? Hi, I am Dr. Kiran Shrivastava. I am a neonatologist and a pediatrician, and I practice in Mumbai. Is a high chair necessary? It's not mandatory to have a high chair when you're introducing solids to your babies, but if you have one, it definitely helps in introducing solids in a safe manner, and it helps in teaching your child that food is eaten at the same place. Food does not follow you around. It helps them learn that they need to be sitting down in one place for a certain amount of time till they have finished their food. And a high chair really helps with that. So how do you choose one that is stable and will help you on your solid introduction journey? The first is it needs to be sturdy. So ensure that it's got a wide base, because babies, as they grow, they like to move around. Even if they're strapped into the high chair, they will want to move around. So you want the high chair to be able to sustain that weight and all of that moving around without tipping over or falling over along with your child in it. So it's always good to apply pressure at different angles when you're testing out a high chair to see how sturdy it is. Some chairs also have rubberized or anti-skid legs that are available, which ensures added stability. The next thing is the 5-point harness. Babies are very sneaky. They will want to run away at the next chance they get. So what you want is your child to be strapped in and not be able to run away when he is being fed. To ensure that, you want to look at the harness. So the baby should be secured at the shoulders, the waist, and at the legs. This is called the 5-point harness. So select a high chair which has the 5-point harness in it. The next is a crotch post. So this is a post that is present between the legs, which ensures that the baby does not slip down from the high chair. So this also ensures that your baby sits upright. We always want to feed our kids when they are sitting up, when they're sitting upright. Never feed your child when they are lying down, and avoid feeding them even in semi-reclining positions, because this adds to the risk of choking and to the risk of aspiration or the food going down the food pipe. The next thing that you want to look at is that the high chair must have a footrest. Having a footrest means that your baby's legs and ankles are at 90 degrees. What this ensures is that your baby's core is supported and they are able to balance themselves much better when they are sitting up. And this is much more important in the period from 6 months to 9 to 10 months, when the babies are still learning how to sit upright more independently. When a baby is sat in the high chair, their body and their hips should be at a right angle. Their knees should be at a right angle, and their knees and ankle should also be at a right angle. Make sure that the seat or the height at which the baby sits is adjustable, because this way you can ensure that your baby is as close to you at meal times. If you are sitting at the dinner table, the height of the high chair can be adjusted so that the baby is also at the same level as you, and the baby is able to see you eating and learn from you how they can eat better. The high chair should be easily cleanable. Babies eat very messily, and you have to embrace that mess, because that is how they have a better relationship with food. But obviously it needs to be convenient for you to clean the high chair. It should be hygienic. Make sure there aren't pockets or crevices where the food can get collected and remain there. So it should be easily cleanable. Another good point is if you are able to easily take the tray off, especially if you're holding a child in one hand and want to remove the tray for cleaning. Another